Hello, this is the evidence-based debate presentation for Group 2 in the Clinical Reasoning Decision-Making course under the title Homeopathic Products Should Be Removed from the Market Because They Interfere with Conventional Care the Patients May Need. And these are the group participants. Homeopathy or homeopathic medicine is a medical system that was developed in Germany, excuse me, more than 200 years ago. It is based on two unconventional theories. The first theory is where like cures like, the notion that a disease can be cured by a substance that produces similar symptoms in healthy people. The second theory is the law of minimum dose, where the notion that the lower the dose of the medication, the greater its effectiveness. Many homeopathic products are so diluted excuse me, that no molecules of the original substance remain. Excuse me. So homeopathy has been a topic of debate since it was introduced. According to the National Health Interviews Survey that was carried out in 2012, over an estimated 5 million adults and 1 million children used homeopathic medications over a year. And the Research Institute reports that worldwide over 200 million people use homeopathy on a regular basis. Yet the FDA has warned consumers about a couple of products. The first one is the Zicam, which contains zinc, or homeopathic remedies containing zinc caused the loss of sense of smell when people used it. In 2015, the FDA has issued a safety alert to consumers using over-the-counter asthma products since they haven't been evaluated for safety or effectiveness. These articles have been published in the FDA according to the reports in FDA or news releases. Further, inconsistent manufacturing practices that created a non-sterile homeopathic ophthalmic drop preparation were reported as a reason for a warning letter to the manufacturer of an eye drop in 2017. In 2016, the FDA has recalled 3 teething products for infants and children containing belladonna, where the levels of the belladonna were inconsistent, and the use of these products was linked to the deaths of 10 children and over 400 adverse effects. An example of such effects was seizures. So a survey carried out in 2002 by the Complementary and Alternative Medicine showed the importance of homeopathic remedy to the lay public. This survey was a questionnaire for adults that lasted or covering a 12-month period, and the adults were 18 years and older, where the use of natural product was rated at 19%. Products commonly used were herbal products, garlic, glucosamine, echinacea, and the common reason for usage, 55% of people who used the homeopathic products believed it would help, 50% were interested to try it. The professional health providers suggested the use in 26% of the cases, 28% did not believe the conventional medicine would work. Some others thought the conventional medication is too expensive for them. So this survey concluded there is a lack of supportive evidence for safety and effectiveness, and with the increased use of the homeopathic products, it creates a market for its use. Yet there is a limitation of the survey where it relied on participant knowledge and usage and costs. When it comes to the pharmacist, with so many individuals using homeopathic medications, a pharmacist has a clinical role when evaluating the safety and efficacy of homeopathic medications in order to better assist a patient in making critical care healthcare decisions. The pharmacist should be prepared to counsel patients and evaluate the appropriateness of these types of medications based on the patient's symptoms as well as medical and medication therapy history. So this quote was taken from an article published in the Pharmacy Times in 2014, and the author has stressed on the role of the pharmacist to counsel patients and stay vigilant on the side effects that might arise because of the use of the homeopathic products. So our group believes that the market removal should be considered market removal of the homeopathic products should be considered based on recent efficacy and safety concerns raised with some homeopathic medications, as well as a recurring lack of clinical data to support homeopathic medication use. So, studies of comparative therapy between homeopathic and conventional medicine have been carried out in order to provide consumers, clinicians, purchasers, and policymakers the ability to decide between options that improve healthcare at the individual and community level. In this study, in 2013, the authors compared homeopathic therapy to treat atopic dermatitis in children with conventional therapies such as corticosteroids and antihistamines. That was a multi-center prospective open observational trial where children enrolled were ranging in the age from 1 year to up to 14 years old, having atopic dermatitis for at least 6 months period, and had no prior corticosteroid therapy in the last 3 months. At 36 months, the authors found among the both groups, there was no significant difference in response rates or adverse effects between both groups, and there was a significant total cost difference showing higher expenses in the homeopathic group therapy. Failure to prove benefit of using asafoetida for treating irritable bowel syndrome was evident in a pool analysis of 2 small studies. In this study, the authors have, or in this review, the authors have attributed lack of benefit due to low quality of reporting, the high or unknown risk of bias, short-term follow-up, and sparse data. Further, the study was focusing on Coqueline, which is a registered French product used to treat nausea. The authors carried a randomized, double-blinded, placebo-controlled, multi-center trial comparing Coqueline versus placebo to treat chemotherapy-induced nausea and vomiting. Patients with non-metastatic breast cancer who were chemotherapy naive were enrolled in the study. Coqueline and placebo tablets were given to test and placebo groups, respectively, in addition to the standard antiemetic regimen, either ondansetron, granisetron, or methylprednisolone. There was no significant difference in the improvement of nausea and vomiting between both groups. And knowing that the study was a multi-center, double-blinded, placebo-controlled, that gives it strength to consider the outcomes of the trial. Some limitations was such as the absence of data collection and patients' belief to group allocation, belief of homeotherapy efficacy, pre-existing anxiety in patients, and any history of alcohol consumption existed. So our variant, here we propose some claims that support our main claim. First, there are situations when modern medicine is more effective and safer based on studies to support the use of medication. Homeopathic medications have few studies, and such studies enrolled small number of patients. Many homeopathic studies also lack the methodological quality. Second, the homeopathic products in the market have not been studied by the FDA to be safe, effective to diagnose or treat disease. The FDA has found lack of manufacturing practices such as dosing errors and sterility errors. In addition, there are supportive data for removing homeopathic medication from the market. In 2015, the National Health and Medical Research Council released a paper examining evidence in homeopathy collected from over 57 systematic reviews, and those reviews included 176 individual studies on the effectiveness of homeopathy in treating health conditions in humans. We're quoting from the study that homeopathy should not be used to treat health conditions that are chronic, serious, or could become serious. People who choose homeopathy may put their health at risk if they reject or delay treatments for which there is good evidence for safety and effectiveness. So this quote is in support against the use of homeopathy according to the report. So our qualifier here, looking at this systematic review for using oscillococcinum to relieve influenza or treat influenza and influenza-like illness. So the authors did not rule out the possibility that it could be effective to treat influenza. And also they had no evidence of clinical harm, yet the quality of the study was low. So pharmacists need to stay vigilant on the therapeutic outcomes of medical conditions when homeopathic remedies are used. The paucity of comparative data on homeopathic remedies against conventional medication, as well as the lack of significant benefit of using homeopathic medicine limits its application. So also we are quoting some reports from FDA news release that beside the lack of superiority of homeopathic medicine over conventional therapy, the FDA warned consumers on the risk of using over-the-counter homeopathic asthma treatments. And another Cochrane systematic review of 6 trials, including 556 patients, there is no enough evidence to use homeopathic products to treat chronic asthma. Furthermore, a double-blind, placebo-controlled trial showed no benefit on lung function or respiratory symptoms when homeopathic immunotherapy products were used in 242 patients with asthma. So our rebuttal is based on the point that lack of supportive evidence-based studies for using homeopathic remedies, therefore long-term randomized controlled trials are needed to be carried out with representative sample size. In addition, special populations such as children, patients older than 65 years old, patients with renal and liver disease should be included in such trials. Thank you. This is our reference slide. Thank you so much for your attention.